opportunities for the most marginalized populations. We will emphasize, among others, the vital role that technology plays in ensuring equitable progress towards the goals of the ICPD Program of Action. And I have to say, this conversation is really timely. And why? Last year, we, at the commission of 67th Commission on the Status of Women, and building on some of the work that we had done on the Action Coalition that I just mentioned, we had laid a foundation by focusing for the first time on tech and innovation and education in the digital age. Many of the topics that we will discuss today in this panel were addressed at CSW. And these include, and are by no means limited to, the importance of taking an intersectional lens by closing the gender digital divide and prioritizing the needs of those furthest behind and strengthening the opportunities and capabilities of all people. Ensuring equitable access to technology for individuals of all ages in all their diversity, including by investing in digital literacy and education, but also addressing things such as social and gender norms. We also will discuss supporting special measures, including ensuring design and development of technology and platforms in partnerships with users in all their diversity, as well as taking a human rights-based approach to the design of safe and equitable technologies, which includes, of course, AI models and designing them as a public good with a gender lens. So we do have essentially a clear vision, and what is now required is really also a strong political engagement for implementation. This year, we have a great opportunity that is provided to us by the Global Digital Compact, which is currently being negotiated ahead of the Summit of the Future. The compact is a once-in-a-generation opportunity to shape our digital future together. And so we need what we need to see in our discussion today, also within that broad frame, and have an excellent and diverse panel that can just do that. And these are again some of the topics that I think I would welcome all of us to chime in on and to really discuss. So without further ado, let me just introduce our panelists quickly. So I have Aral Sumeli, who's the founder and president of Medical Rescue Association of Turkey. I have Prashant Verna, who's the general secretary of the National Association for the Blind in Delhi, which is a premier NGO working for the empowerment of persons with blindness, low vision, and multiple disabilities. I have Candela Yache, who's the founder of Balamente, a nonprofit organization dedicated to preventing eating disorders, promoting social acceptance of body, sexual, and gender diversity. And right on my left, I have Lily Dong, who's Rosengar, who's ILGA World Senior Officer on Gender Identity and Gender Expression. We have another panelist who will join us later, who's Miss Cinnamon Love, who's the co-founder of BIPOC Adult Industry Collective, which is the only organization in the US that specifically focuses on the needs of Black, Brown, and online sex workers, content creators, and prom performers. So, again, an excellent lineup, and I will just start with sorry, let me just get the lineup right. Lily, I'll start with you. How do you see technology promoting the movement towards gender equality in all its representations? And do you witness associated harms as a result?
Thank you very much. I'm really pleased to be here. Thanks for the invitation. As we know, technology is an incredibly powerful tool, and like any tool, can be used both positively and negatively. And for many of us, technology is completely inescapable. It's integrated into every aspect of our lives, and it helps us in many ways, but also recognizing that itself can be a very privileged perspective. And so we have to as has been mentioned even this morning and yesterday, the digital gender divide is constantly widening. And it's important that when we look at the benefits that technology brings us, especially when it comes to gender equality, that we look at the harms too. And given the focus of this session is on reaching the furthest left behind, I will also focus a lot of my remarks on the LGBTI community as I work for ILGA World, which is the Global LGBTI Association. So to begin with some of the positives, a key aspect when it comes to sexual health and reproductive rights is access to information and resources. So particularly when empowering and working with women and girls and marginalized groups, the access to online platforms offering courses and trainings that are otherwise inaccessible is extremely important, because we know that girls are often the first to drop out from school compared to their brothers, for example, whether due to adolescent pregnancies, forced marriages and unions, through poverty, climate crisis, conflict, and so on. Due to gender inequality more broadly, we know that when parents have to decide who is going to be in school, it is often the brothers that are prioritized. And so access to information and education online is critical, so that when girls do drop out of school, that they still have access to the education that they may otherwise not be able to access. And also from the LGBTI perspective, LGBTI youth are subject to high dropout rates due to bullying and harassment at school, especially trans youth who have a extortionately high rate of dropouts from school. So the need to access information online, especially access communities that otherwise they would not be able to access in the formal school environment, is highly critical. Another piece that is extremely important with online accessibility is the access to health information that you can get from online, from telemedicine and online health resources to provide critical information on sexual and reproductive health, mental health, and general well-being is critical, especially when it comes to topics that are otherwise taboo, that you may not be able to teach in restrictive contexts, that you may not be able to ask questions about and find out about in formal education systems. So the access to have this information online and in protected ways is something that is very necessary for communities who are often left behind. And support networks of online communities to offer support and solidarity, share experiences, seek advice are communities that often people who are from marginalized groups cannot access through formal education. Also, campaigns and movements are not found in formal education, and so the access to these spaces online is also very much needed, whether we're talking about ICPD +30, Beijing +30, and so on, the two main processes we're thinking about this year. We need to make sure that everyone can access that information, and that being done so online. So those, I'm just highlighting some of the positives that many of us all know about. But now to get into the harms, as per your question, it's clear that like all human-made creations, what we create reflects our reality. And sadly, gender inequality and marginalization is very much a part and parcel of that. We see it from ownership of devices in the first instance, where men and boys are far more likely to own devices compared to women and girl counterparts. We see it in biases from how AI has been programmed, reflecting the often white, cis, middle-aged men who create these AI technologies and technology itself. And we see widespread online violence, harassment, cyber stalking, censorship, abuse online, and widespread disinformation campaigns. So briefly, just to mention, of course, we know the digital gender divide driven by economic disparities. We know that the digital gender divide can limit women and girls' access to life-saving information, mobile money products, agricultural extension, for example, online public services. I also want to talk about privacy violations and surveillance, especially when it comes to doxing and outing, and when it comes to the LGBTI community, because online, we see cases of entrapment often occurring where fake profiles or surveillance tactics on, for example, dating apps or social media are used to entrap and persecute LGBTI individuals, particularly in regions with repressive laws against homosexuality and gender nonconformity. And it's often a tactic used by law enforcement and authorities and malicious actors, where they use online fake personas to connect with the LGBTI community under false pretenses, and then entrap and blackmail, and then in many cases torture users. So there's some examples of that from Russia to Egypt and Paraguay and across the world. And just, I know I have very little time, but algorithmic bias, issues in content moderation, violence online, and outing of people online is major issues. And so we need effective measures, including robust legal frameworks, improved digital literacy, corporate accountability, all to mitigate these harms and ensure that technology contributes positively to the movement towards gender equality.
Great. Thank you very much, Lily. And so, and I'll turn to Aral, but just to remind speakers that we have about 5 minutes to answer the question, so that we can have some time for discussion. So, Aral, to you, getting healthcare to some of the most vulnerable populations in the world is a critical role for Hera Digital Health. Can you speak to the role of technology in reaching your goals and some of the challenges that you faced?
First of all, thank you for having me and thank you for joining our session. So at Hera Digital Health, what we try to do is help refugee populations, especially women and children, access healthcare in the host countries. And the reason for that is our health systems all over the world historically are created for people who are born and die in the same place. But we know the truth of the world is changing, and health systems are not ready for this. So we see that the physical movement, with including like financial and social movement of the people, require solutions that move with them. And that's kind of the main idea behind how we started Hera. And we help refugee women carry their health records, connect with local health services, call ambulances, get information, up-to-date information, such as during the COVID, and really talk to someone using our AI-powered chatbot as a person who can, or as a confidant for themselves. So technology is obviously a critical part of our work, and the kind of the mobile technologies we use are, again, able to move with the people. That is why we focus on that. But I would also like to stress that, and I do see it in my own organization or on other organizations as well, the technology is the enabler, not the end point. So we do focus on technology, we use technology, but we use it the way that solves the problems of the people. It's not just having the highest end technology. And the reason I'm saying that is I'm not a technical person, I'm a medical doctor, and I spent years trying to learn coding of YouTube, which is a great, hobby, but not something that you can, do yourself. And then we realized it wasn't really how or which language that we use to develop the technology, but rather how we're solving the problem of the people. So for refugee women, they are double vulnerable, right? From accessing, healthcare as a woman and for their children, but also as refugees who have different kind of statuses in different countries. In my country, Turkey, majority of the refugees are called temporary, guests for whatever reason. But this means that the transient nature of being a refugee means you don't have access to all of the tools that the national population has. So for us, technology is how we solve the problems or how we bridge the gaps. And that's how we use technology in there. And some of the challenges, and I would, again, hope that many other groups and organizations focus on that is the users' experience of how they use the products we have. We can have the best, amazing, never crashing mobile app, and if people are not using it, it doesn't make sense. So whenever we design something or we add something, the major thing is whether people are going to use it or not. So for us, the chatbot, when we first started designing it, and this is not an promotion of any company, but we used WhatsApp. The reason for that is WhatsApp has spent a lot of time and energy on making sure their communication works in lowest bandwidth possible. So I don't need to go around and create a new product because there is already something that works. So that's an example. So technology is a major part of it, but it's not the end point, but rather the enabler of healthcare access. So thank you.
Great. Thank you very much. And that's an excellent point. So, technology can be a solution, but I think, first it has to be people-centered, right? So, and, if you focus on use, I think you already have your problems. So thank you very much. So, Prashant, let me turn to you. Aral spoke about an AI powered chatbot, and you've created an AI powered one to provide easy access to sexual and reproductive health and rights. Can you tell us how it facilitates access to those that might otherwise be unable to get reliable sexual and reproductive health and rights information? Why was this project important to you?
Yeah, thank you very much. And thanks to UNFPA for the invitation. So I have been working in the field of digital accessibility and assistive technology. And therefore, I have been working with a lot of people with different disabilities in India. And we observed that young people and including persons with disabilities, they face challenges in accessing information related to sexual and reproductive health. This is because of various factors. Firstly, this subject is considered a taboo in many societies, and they are not able to discuss this subject with their friends or family. And then the challenges are even more for people in semi-urban and rural areas who have limited internet access. And then there are people who have lesser digital skills and literacy. And the online websites and portals and apps which tend to have such information tend to be very complex and difficult to navigate and often very inaccessible for persons with disabilities. So with the support of UNFPA, we have just tried to create a solution for this. Last year, there was a accessibility innovation challenge launched by UNFPA. And our project was one of the 5 projects selected to create a solution, technological solution for challenges faced by people with disabilities. So our company, Accessible, has created a AI-powered chatbot that can be easily used using WhatsApp or IVR, that is interactive voice response. And it provides credible information on SRHR. So we have used large language models. We have collected the data from trusted sources such as the UNFPA website and reputed not-for-profit websites, and created a conversational system. So people who don't have access to internet or who are not able to buy a computer or a smartphone, even those who can use or have a feature phone, they are also able to use this service. All that they need to do is either do a WhatsApp conversation with our system, or they can even call a standard mobile number and just speak to it and get responses. So this system currently works in English and Hindi, and people are able to not just send text messages, but also voice messages as well. And the system responds using text to speech. and it responds in the same language in which the question is posed. So, we have observed this system was launched earlier this year by NAB Delhi, a not-for-profit in India, and it has received very good response. Young people, including even severely disabled people, they have been able to easily use the system. The system ensures that the privacy of the user is retained, as the data is deleted after the session ends, and it doesn't ask for any identification, any information to verify the identity of the user as such. So that people can confidently use the system. So so this system now being used by several thousands of people in India, and we are trying to give access to more people, and in particularly trying to add more languages so that peoples of different region can easily use this information. Based on this same technology, we have been actually developing some other solutions as well. If we just replace the data set, then this system can be useful for some other subjects as well. Yeah, thank you.
Great, thank you very much. We're really informative, and I particularly like the the scalability aspect of it. So, Kanela, let me turn to you. Young people are our digital natives, but access and use is not equitable, as we've talked about here. You founded Belamente, an organization dedicated to promoting social acceptance of bodies and sexual and gender diversity. Can you share some insights from your experience that can help organizations and communities foster a more inclusive digital environment for body diversity, sexual diversity, and gender diversity?
Sure. Thank you. Hi, everyone. I'm really happy to be here, and I couldn't agree more with what my colleagues told before. I believe that a good way to illustrate inclusion in digital spaces is to think of them as a physical territories with which we are more used to assessing their capacity to include or exclude people. If we were talking about a park, what would it need to be included? Addressing the first aspect, access. We need to ensure that everyone can enter. Is there a ramp for wheelchairs? Are the doors accessible? Are the signs that everyone can understand? Okay, accessing digital spaces translates to creating a user account, for instance, and taking the first steps on the platform. In this area, the main accessibility obstacles often relate to a lack of disability perspective. However, inclusion does not end with access. Staying in space is also crucial. Returning to the park analogy, imagine we could enter perfectly to the park, but other visitors started throwing at us stones. Could we say that the park ensures our continued presence there? There is where the main obstacles to inclusion regarding bodily, sexual, and gender diversity appear in digital environments. Hate speech is rampant and widespread. The platform rules tend unsatisfactory or easily avoided. Ridicule and criticism of appearances in posts and reels. Conclusions about people's health based only on their appearance in TikTok. In Argentina, there was even a significant increase in dengue cases, an epidemic we have battled for years, and people on Twitter were posting memes glorifying getting infected because it helps them to weight loss. So how are these environments friendly for people with non-conforming bodies? What best practice do I recommend to organizations? There are two main keys. One, representation. If we want people to feel welcome in your park, it is important to show individuals of diverse appearances participating. 2. Active stance against hate speech. Moderate comments and foster an open dialogue about the messages that will not be tolerated in that community. Thank you.
Great. Thank you very much, and really good analogies there. I think with the physical world. So, Cinnamon, thank you for joining us. I introduced you earlier, and they've been expecting you. So, what, in your opinion, is the impact of the tech has the tech industry been on sex work, for better and or for worse?
Thank you all for being patient with me getting here. Traffic in New York City is crazy. Also, I'm jet lagged, so I just got back from Geneva on Tuesday, so I'm tired. I want to start by clarifying that today I'll be using the term sex work to describe the diversity in both formal and informal sexual economies. In the last 3 decades, we've seen that technology has radically shifted the way that sex workers work, in many cases reducing profiling for quality of life crimes that result in over-policing and criminalization of low-income and poor communities. Digital tech offers sex workers engaging in prostitution the ability to cross land borders and increase earning potential outside their home community and retain their privacy. For sex workers working as adult content creators, the online subscription-based business model cuts through the haze of credit card processing, chargebacks, and web hosting for a percentage, and lowers the barrier of entry and offers an opportunity for entrepreneurship. Today, sex workers are able to work outside the archaic studio model that the porn industry was built on, using social networks to build brands as influencers and sell direct to consumers by monetizing a wide range of content on fan sites and streaming platforms. Technology allows sex workers to be themselves, no matter how quirky, nerdy, or niche they may be, breaking down the white male gaze of racialized sexuality and beauty. Sex workers can be found monetizing streaming video games, practicing yoga, cooking, alongside their nude and sexual content, breaking the third wall and allowing their followers to get to know them as individuals. In 2020, we saw 1.2 million sex workers and individuals sign up for OnlyFans to support themselves during lockdown to support themselves, their families, and their communities when the existing administration barely threw Americans a bone and left sex workers and sex-related businesses out of the pandemic unemployment benefits altogether. Sex workers are extremely skilled at using social networks to build systems of community care, provide and seek mutual aid, skill building, and education on the same social networking platforms that they use to sell content and engage with their subscribers, their fans, and their clients. My organization, BIPOC Collective, was founded during lockdown to remotely provide holistic resources to sex workers of the global majority. And we aren't the only ones. Currently, there are over 230 sex worker-led organizations in the United States using technology to reach stakeholders and provide necessary resources and support. Sex worker-led organizations like Blue Pearl Therapy and Zep Wellness and allied organizations like Pineapple Support offer remote one-to-one and group mental health and somatic therapies, reaching the most marginalized workers where they are. Organizations like Pass Certified and Empower use technology to reach sex workers both in and outside of the studio system to provide routine, scientifically accurate sex education that includes STIs and HIV symptoms, prevention and treatment, and connecting community members with up-to-date industry-wide production holds due to high cases of infection, and as well as connect them with local testing facilities or self-collection kits. These organizations help new community members become aware of the industry gold standard of testing that reduces window of error on the window of error. Sex workers regularly use these virtual sessions to pay for industry standard STI and HIV testing for community members who cannot afford the cost of doing so. One of the newer developments that I'm really, really excited about is AI technology. Recently, I attended an adult creator conference called XBiz Miami, where I learned how companies using AI are creating AI chatbots that would do voice synthesizing and collect personality traits to so that disabled, chronically ill, aging, or exiting sex workers can still monetize their image and likeness. And sell existing content to ensure that they're able to earn a living even when they're unable to work. In the age of long COVID, I'm really going to be keeping an eye on this. It's really exciting. Also, as someone who's been doing this work for 30 years, I'm ready to exit, and an AI chatbot would be amazing. Because the AI needs to learn what human bodies look like. Right now, the technology is only available to cis women. It still needs to, we all know that when you look at AI, the fingers look really wild. And this AI company that I was talking to in Miami was explaining that they have to catch up. The technology has to catch up so that penises aren't looking like tentacles, and also so that women, so that and trans performers will also be like later down the line as the body, and also sex workers with other physical deformities will have to be later down the line. On a federal level, so I'm going to skip ahead. The biggest threat that I see right now is the conflation of sexual labor with trafficking. At the federal level, financial discrimination limits sex workers' access to banking, venture capitalist funding, and launch and grow businesses, unfair credit card processing fees. And the individual states are attempting to pass unnecessary age verification laws under the guise of protecting children, but in fact, put consumers at risk for identity theft and limit access to marginalized workers in those states who rely on online sex work to survive. Digital policing and biometric surveillance often result in shadow banning or deplatforming, not only from social networking sites and subscription platforms, but in some cases, companies like Airbnb, and prohibits immigration and travel solely on the suspicion of prostitution. Digital surveillance can also be traced to doxing, stalking, and harassment under the guise of rescue. And while responsible AI has fantastic potential, deep fakes and other available online data are already interfering with the intellectual property rights and threaten the safety of sex workers and sex worker human rights advocates through a false narrative creation. So thank you so much. Tried to squeeze it all in really fast.
Yeah, and thank you very much. And maybe I'll just stay with you for a follow-up question. And it's, you've spoken about how the technology is essentially changing the nature and how sex work is done, but there are also challenges. There are also pitfalls. And how do you, within an age where an AI chatbot, for example, can create content, how do you protect within this this environment? How do you protect the rights, safety, and of sex workers?
I'm so glad you asked that. One of the questions that I asked when I was in Miami was this very question, right? Around intellectual property. And, when I signed model releases back in the 90s and 2000s for companies, you're signing a model release for for all technologies in perpetuity. And my understanding from one of the industry lawyers is that there is an argument to say that release did not include AI technology because the technology didn't exist, right? And so there is an argument that could be had for workers who have the means or the access to be able to fight companies using their image in, AI produced content. I mean, we're going to start seeing this a lot. I mean, we're already seeing it a lot in the music industry, with people, people using deceased performers to create new content with them, either through voice or through, holograms. And so this kind of thing is going to we're going to see, I think the adult industry is going to really expedite that fight, because we're always the canary in the coal mines. So I think that because we're already seeing deep fakes of sex workers in the marketplace, that you're going to see this happen very, very quickly on our end. In terms of the average individual creator or sex worker, I really don't know what can be done yet. I mean, my biggest concern is that, like during lockdown, we saw some, very right-wing niche folks who were compiling lists of sex workers who were pro BLM and, in their words, like Antifa, right? And so, one of my concerns is the way that AI technology will be used to harass people, to put words in their mouth that didn't exist before, to create these narratives around the things that you're saying. And I think that as the AI continues to advance, that it's going to be harder and harder to differentiate between what's real and what's not. And right now, because AI is still the Wild West, there are no laws around AI. It's, we're in a position where we have the potential to create really responsible, sustainable technology with the most vulnerable people in mind. Like, we're already starting to see, like Instagram, you have to include, a tag that this was created with AI on it to differentiate between what's real and what's not. And I think that we have to continue to do that in terms of, like, how do we identify that this is not the real person? What laws need to be created to make sure that people know that this image that you're looking at, this video that you're looking at, is not the person itself? Yeah.
Thank you very much. And, that's really, I think, an excellent point. And that leads me to you, Candela. Can you speak about how digital platforms are playing a role in both perpetuating and combating violence, digital violence in particular, but also, combating mental health crisis? And we see a lot of that right now. One of the challenges, for example, is promoting certain types of beauties and bodies. So how do you see digital platforms playing a role in this area?
Okay, to be honest, this is a dichotomy that we frequently address at Bellamente Foundation, and one that we are passionate about. Firstly, digital platforms significantly influence standards of beauty and body image. Algorithms prioritize content that aligns with conventional beauty standards, which can perpetuate unrealistic ideals. This constant exposure contributes to body satisfaction, particularly among young users who may feel pressure to conform to these standards. According to a study that we conducted in 2020, we found that more than half of the sample felt unpleasant emotions after using Instagram, such as frustration, anxiety, envy, distress. Additionally, 86% reported feeling bad about their bodies after seeing a post on the platform. Secondly, the anonymity and reach of digital platforms is key in understanding digital violence. Cyberbullying, body shaming, and harassment are prevalent issues that can severely impact mental health. The viral nature of content means that harmful messages can spread rapidly, causing significant distress to those targeted. The ease of making fake accounts makes this problem worse because it allows people to harass others without facing consequences. However, it's not all negative. Digital platforms also have the potential to be powerful tools for combating these issues. For instance, nowadays, if you search words related to body image, to negative body image on Instagram in Argentina, you are redirected to a map of care centers, both public and private, in all provinces, and a guide for caregivers of people with eating disorders. That is because of an alliance we made from Measurement Foundation with Meta and the National Ministry of Health back in 2022. Digital platforms are also spaces where campaigns that highlight real and edited images and personal stories can be displayed, helping create a more inclusive and accepting online environment. To illustrate, during the International Eating Disorders Day, we spread a video on Instagram showing the impact of social pressure on people's mental health. The campaign reached 7 million people. Since that, we got even more involved in educational campaigns and made an alliance with the United Nations Population Fund to raise awareness about digital violence and to promote safe online practices with resources meant to empower users to recognize and report harmful behaviors. In conclusion, while digital platforms can perpetuate mental health issues and digital violence, they also hold the potential to combat these problems. In Measurement Foundation, we truly trust and bet into the transforming side of social media and digital platforms, because fighting against their existence is not realistic. And just to be said, these issues did not start when the internet was created. By promoting diversity, implementing supportive filters, and actively working to eliminate harmful content, this platform can create a safer and more inclusive digital space. It's essential for platform providers, users, and policymakers to work together to harness the positive potential of digital spaces while mitigating their risks. Thank you.
Great. Thank you very much. And I like the fact that you connected to the positives, because I can already start hearing my boss's voice in my head, who always says, "Don't ask me questions, give me solutions," or at least if you ask a question, come with the solution. So happy to really, I think, shift to that. So Prashant, I'll go to you. In your expert opinion, how do you envision effective scale-up and leveraging of partnerships and collaboration amongst stakeholders to strengthen technology for inclusive development?
Yeah, thank you. Yes, I think partnership between different stakeholders is necessary for ensuring that the technological solutions are scaled up and impactful. I would like to give an example of our project, how we partnered with different stakeholders and how it has resulted in a useful service which is serving many people. So we tried to partner with the organized civil society organizations, government agencies, and in particular the community, even while we started designing the project. First of all, thanks to UNFPA, the funding part was taken care of. And then we worked with young people, organizations of people with disabilities as well, to understand what are the problems they face in accessing information related to sexual and reproductive health. And then the solution was designed. We also partnered with other technology companies, in particular, Microsoft helped us with the core technologies like cloud services and some speech recognition technologies. After building the solution, we realized that the language of the content created by the AI was not so suitable or not easy to understand. The terms, the words that were being used over there were not really the words that people were using in day-to-day life. So we partnered with an agency which was conducting various kinds of training programs and awareness programs at the grassroots levels on this subject. And we partnered with them to use the content they had created for different types of trainings and awareness materials. And we used it to train our AI chatbot. we replaced those terms with the words that people are using in day-to-day life, and that way we were able to kind of, you can say, make the service more useful. So so I think now if a similar service is required in some other region, then I believe it's better to kind of do some partnerships instead of recreating similar solutions, particularly in low resource settings. If a similar solution exists in some other part of the world, then I think it's better to adapt the solution, then partner with the local community to understand the local context, bring in the changes that are required in that context, and then use the solution. It's also necessary to I just want to emphasize that that engagement with the actual community and the actual users is very necessary, and doing some kind of, you can say, involving them in the planning stage, then doing some kind of a pilot study as well, and then also adapting and changing, improving the technological solution is also very important. So that's what all we try to do, and I think this kind of thing is necessary for all similar projects. So to make sure that they are accessible and usable, and they have a high impact.
Great. Thank you. Thank you very much. Really interesting work, I have to say. So Aral, over to my favorite topic. So as I said, I lead the work on research and data at UN Women. So a lot of the work that we do involves data collection, monitoring, and evaluating impact. So can you tell us your thoughts on how how Hera Digital Health is using technology to monitor and evaluate the impact of your digital health solutions, and ensuring that they are reaching the most marginalized populations? And can you also tell us a little bit more about, just some of the impact that you've seen?
Yeah, thank you for the question. And it definitely is not my favorite thing to, but so what we're seeing is, with the inclusion of technology in our solutions, our old models of M&E, where it's like input, output, outcome, impact, or directional evaluation, actually are not very suited for that. And tech companies realized it some time ago, and that's why they're using agile methods and piloting different things, trying different things, and changing. But we are taught, at least as nonprofits, project cycle management, where it's one directional, and we are seeing that technology is changing that, and there is a kind of a miscommunication between our tech team, for example, who loves quantitative data, this much views, this much that, and the field team, where it's like, yeah, but where is the impact? And we need to be able to use both of the sides or the dimensions to really understand the impact that we have, and make sure that we can actually reach the people who need it the most. So I would say for us, it's really trying to understand that and actually manage that or evaluate that change, because going back to the same point, we used to write grant applications for 5 years. But if I'm doing what I said I'll do in the next 5 years, it means I'm very behind on the current technology and what I can do. So this means smaller cycles of improvement, evaluation, and actually using that not just as a tool to say, hey, we had this much impact, but rather involve it in the developing of the next phase. And that is the importance or beauty of using these kind of mobile technologies. It's easy to pilot, try something, and change it. That is to the point that I won't be doing what I say I'll do in 5 years, and I shouldn't really do that. Things are going to change. So for us, the evaluation comes from two different sides. One is the technical, that might tech people love to, talk about, hey, Aral, we had this much increase in learning about the new health centers in the earthquake zone in Turkey. And then the field team is saying, yeah, they see it, but they can't actually go because they don't have their, ID cards with them. So marrying those two things to see how impact actually happens is very valuable for us. And also we see that both negative and positive externalities of everything we do. No technology is inherently good or bad, but that's how we use it, right? And as a health organization and as a medical doctor, my first principle is do no harm. So I have to not just see the impact of that what we do, but we don't mean to do. So that is my way of saying that M&E is tricky, getting trickier, and definitely not my favorite thing. But yes, understanding impact is extremely important because we focus too much sometimes on the outputs. How many people downloaded our app? That's great, but unless you're Facebook, it's probably, you can't assume that they're all using it. So that's my point. So sorry, I don't have a, like a great solution like you did, but yeah, thank you.
No. I mean, that's exactly what M&E is for. So M&E is so that you can course correct as you need to. So if you just use it to, I mean, for standard reporting, I think you're actually misusing it. So I think your point is actually exactly that. So Lily, now over to you. We've talked about, I think, some of the pitfalls of safeguards that are needed actually for, to prevent hate speech, misogyny, tech facilitated violence, and so forth. Particularly including among LGBTI populations. How can you ensure innovation and technology are used to empower women and girls and other marginalized groups who are left behind?
So I think, first of all, it always comes down to engaging the communities that you are creating these tech and innovations for. And so it's always critical to begin with the principle from disability justice communities of nothing about us without us. Because when you involve the communities and all the diverse groups, not just that are represented on this panel, but all marginalized groups, then the tech will be able to respond more adequately. And so that involving these groups throughout the development, testing, and implementing of technological advancements. As I mentioned earlier, the creators of these technologies often look a certain way, and we need to make sure that the developing teams are also well represented in different marginalized groups as well. It's also critical to push for legal reforms and infrastructure support. So ILGA World published a report earlier this year that I suggest you might want to take a look at. It's about accessing connection and bridging the digital divide for LGBTI communities worldwide. And in that report is an emphasis on the need for legal reforms and infrastructure support, given that a major barrier to online participation is legislation that limits the digital rights of LGBTI communities. So this includes the criminalization of LGBTI and diverse communities, as well as sex workers and so-called morality laws, and surveillance and a lack of victim protection for incidents of online violence. And as we know, online violence is a difficult legal category, as many countries do not recognize online hate as a form of hate speech or hate incidents. So we need to continue to work and advocate on that side of things. We also need greater investment and support for expanding broadband infrastructure and regulation, and subsidizing or fully covering high internet costs, and looking at internet as a human right and access to information, centralizing that in our advocacy. It's also critical to have capacity building. Women, girls, LGBTI people, and the intersections and all marginalized groups, we're all trying to stay safe online, but more can be done to provide capacity building, support for digital security, raising awareness about laws and advocating for change at a macro level will protect digital rights and promote digital inclusion. And it's needed that we have increased awareness around laws that do threaten online safety. as well as knowledge sharing around legal protections to freedom of expression, which are vital towards combating online violence and threats to privacy. Digital literacy and digital security are very much needed as well when we talk about education and awareness of use of tech and innovation. And this needs to be greater funded and trainings on how to be safe online, especially for criminalized populations where technology is being used, for example, as mentioned earlier, by law enforcement to further persecute marginalized groups that are already criminalized by the system. And then just to close, I wanted to mention the Yogyakarta principles, which are a set of principles that were created in 2006 as a landmark set of principles regarding the application of international human rights law on sexual orientation and gender identity. So in the Yogyakarta Principles Plus 10, in 2016, there was an introduction of a new section on the right to the enjoyment of human rights in relation to information and communication technologies, which declares that everyone is entitled to the same protection of rights online as they are offline. Everyone has the right to access and use information and communication technologies, including the internet, without violence, discrimination, or other harms based on sexual orientation, gender identity, gender expression, and sex characteristics. So secure digital communications, the use of encryption, anonymity, pseudonymity tools are essential for the full realization of human rights, in particular, the rights to life, bodily and mental integrity, health, privacy, due process, freedom of opinion and expression, and peaceful assembly and association. So I think that principle very much speaks to the different marginalizations and groups that are all represented on this panel and more. And I hope that we bring that into the work that we do on reaching those furthest left behind.
Great. Thank you. Thank you very much. And a really excellent point there. This is probably, I think, the first panel that I've ever moderated that actually stayed on time. So thank you to all of you, I think, for, for your clarity, for your excellent points, and really, again, also giving us enough time to have a discussion with all of you. And comments, questions to any of the panelists, but also, if you have an example to share, for example, on work that you're doing, for example, or you've seen on technology being leveraged to expand educational opportunities, access to remote areas, marginalized communities, all are welcome. This is really a conversation, so please feel free to come in on any points. And all I would ask is maybe when you take the floor, just introduce yourself and tell us who you work for or what do you do. Thank you.
Thank you. Thank you, moderator, and thank you for the participants. I'm Anit Mukherjee. I'm a senior fellow at the Observer Research Foundation America. It's a public policy think tank based in Washington, D.C. First of all, it was amazing to hear all the presentations, but I'll limit my questions to our friend from India and Turkey in the first set, and a friend from the US. So on that first point, I think both of you have created a digital tool for accessing last mile or populations which are not generally involved in the thinking when an app developer or whoever is the technologist tries to access those. My question is, and I'm an economist, so I'm kind of an imposter in this technological game. So you understand my problem, right? So the cost sometimes is pretty high. Cost both of identifying the issue, at addressing the issue, taking into account the people whom you want them to build. So sometimes the cost goes pretty high. How do you address those cost problems, right? And also cost of maintenance. So that's my first. The second, and I was amazed and amazing work, and I used to work on HIV for many years in the early 2000s, and I understand the challenges where you come from, and it's amazing to see how far we have come in terms of community mobilizing for access for first-line drugs, then second-line, reducing cost. My question is, how does technology enable or make it difficult for the community to mobilize? I think you mentioned a few sites, but is there, what challenges do you face in terms of just physically mobilizing, maybe getting people on the street rather than just, clicking likes on a platform? And how does that impact on your work? Thank you.
Great, thank you very much. So maybe let's see if there are any other questions, and we can take a few before going back to the panelists. Or okay, so maybe let's just start with Prashant and Aral, and then Cinnamon.
Okay, I believe the question to me was regarding the cost, I suppose, is it? Okay, all right. So in India, actually, I think India is very strong in IT, and I will say that relatively the cost of developing new technology, new apps is not that as high as it would be in a developed country like the USA. So we were able to actually manage the cost, the app development cost at least. Now, the other good thing that's happened in India, for example, is that the telephone usage costs are almost nothing. Like one doesn't need to pay for each message or each call. So for the user, it's like kind of totally a free service. They just need to kind of pay a monthly fee to access all telecom services. So that way, one thing was taken care of, that for the user, there is not much cost or no cost actually. On our side, as the usage increases, then definitely we need to pay some cost, some fees to the telecom providers and the service providers, and we are trying to kind of do more partnerships with some funding agencies or governmental agencies so that they can take care of those costs. And another thing we are trying is that we can replicate this same service that we have created for some other agency for some other purpose, and maybe we will be able to raise some funds from that and then sustain our service. So that's how we are trying.
Great. Thank you very much. And just maybe a quick follow-up question. So one of the things that we see in technology, for example, are economies of scale, right? So the more you add people, the cheaper it gets, basically the unit cost. Is this the case? Have you seen that in your work?
Yes, of course. That's the case. As more and more people will use it, I think the per person uses cost will definitely diminish. And so it's something like whenever somebody uses this service, the telecom companies at this time are asking us to pay a certain fee, and they are having some packages where as the users increases, those rates drop significantly. So that way, yes, the more the users, the is better, I think.
Great. Thank you very much. And over to you, Aral.
Yeah, I agree with all of it. One thing I would say is put the word out there to innovation. And it's, at least from my point of view, it's not the cost in the quantitative sense, like 5 million, 10 million, but rather willingness to invest in innovation. So traditionally, the way, I mean, I do global health and humanitarian aid, and how they work is we measure impact as how cheap it was to, save a life or improve quality adjusted life years, disability adjusted life years, and everything, which made a lot of sense for a long time, but that only works in status quo. If we need to innovate, then we need to spend a lot of money without the showing that. And I am optimistic that the donors, funders, supporters are changing their mindsets, but there is also the historical notion of risk aversion that may hinder innovating. So I wouldn't say the costs are, I would actually say costs are less than implementing other solutions with similar impact, but the upfront costs are a lot. And again, going back to the project cycle, we need to be able to make mistakes and learn from them. It's not, if you are looking at, we need this project to win or succeed, that's not the point. We need to learn and we need to change. And yeah, that's how I would put it. So it's not the costs, but rather the willingness to invest in innovation.
Great. Thank you very much. And over to you. The question on mobilization.
So I want to say that I want to name that, there's often this misconception that like street-based workers are not online workers. And we did a very small segment of like data collection in 2020 and found that 61% of people of the global majority who are working in the sex trades work across both formal and informal economies, so both in criminalized and legal labor, and often, may also be experiencing housing and food insecurity, may also, so many people tend to, that you might find someone who is doing street-based work, dancing, working in a massage studio, as well as doing content creation, all concurrently. And so, it is, I think that that's something that's really important to recognize that, one, the cost of technology has dropped, significantly, allowing people to have access to being able to work online. Whereas, 20 years ago, you had to, I was running a T1 line into my my apartment in order to, or into my house in order to be able to stream camming. Today, you can do it with a click of a button on your phone, right? And so because the cost barrier has dropped, even, street-based workers are also online, right? And so when we are doing like a Twitter Spaces with health organizations, we're getting a really wide segment of the sex worker population simultaneously to be able to spread information, particularly, as I mentioned earlier, around like production holds when there is like a high, when there are like positive HIV infections, to let people know that we have a production hold. This is what's going on. This is when you need to get tested, and then spreading that information. There are also, and like I said, there's one of the organizations I mentioned earlier, Empower. They actually do, they mail self-collection kits, because the industry standard of testing is actually like the test that most like health clinics and doctors would use to as confirmatory tests are what we use as our first line of testing, so that we're closing that gap, that window of error in terms of like when whether or not you're HIV positive, right? And reducing the potential for false negatives. And so when we do these kind of like these Twitter Spaces, you get a lot of people who are not familiar with the industry standard of testing, because they're not connected to the studio system. And so using these kinds of, like, we were doing during lockdown, we were doing Zoom calls. Now we can go on Twitter Spaces and get like 2,000 or 3,000 people in a room at once and like spread information instantly, not only about production calls, but also like to answer questions around sex education, to make sure that we're myth busting around how people are contracting, contracting STIs and HIV, but also to like to break down some of the internalized whorephobia and stigma that people have around sexual practices or types of sex work that people might be engaging in, and that relationship to STI infections, right? And so, and then at the same time, there are also still grassroots organizations that are doing the on-the-ground work, going into communities, going on strolls, making sure that they are talking to people about, about testing, putting money in their hand, providing them with condoms, providing them with other things that they might need, as well as, like giving them other resources to organizations that they might want to make contact with. Unfortunately, we and also we've had conversations around like providing money. We also pay for things like, like phone bills and internet access. And we've, within my organization, we've talked about like creating a tech program where we can provide people with refurb technology, whether it's phones, cameras, providing them with hotspots in like rural areas and things like that. But unfortunately, like sex worker philanthropy receives less than 1% of all philanthropic funding. So in terms of like feminist, like funding opportunities, we receive the least amount of money, and we're barely scraping by as it is. So it's really hard to like create a 5-year plan around providing technology to people because there's no money to do it. And so if there's people who want to like help the cause, like holler at me, and we could talk about some money that needs to go into to make sure that people can do this work.
Great. Thank you very much. And this kind of brings us to a close, but I would like to just slip in maybe a question to really any of you. And it's really linked to, I think, what you've said, learn and change. And this is, I think there is no other space where this is as true as when we are talking about technology, because the stuff that you're working on developing now can be obsolete before you actually finish developing it. So, and there are also new risks that probably we didn't know about that are always creeping up. And so what tools do we have, and how do we adapt to make sure that we are really, again, not behind the 8 ball all the time, not catching up each time something new comes up? Or is this basically what we just need to live with? So this is more of an open question to really any of you for any of you to come in.
One kind of the way we like to look at it is, yeah, there is no way to catch up, or you're just gonna spend your time trying to catch up. But I think this was from one of the founders of Y Combinator, who would put it as be in love with the problem, not the solution. So what we have right now, I demo a couple of our tools everywhere, but they can change instantly and momentarily. It's about solving the problem. So a quick example is, I don't know if everyone knows it, but there was a huge earthquake in Turkey and Syria last year. And actually I'm from that region that got destroyed. And I was in the US, middle of the night. My team let me know we have, disaster relief people. So they were deployed instantly. And I quickly went to join them. But one of the tools we didn't really focus on was health center navigation, because there's Google Maps and everything, but in an earthquake or in a humanitarian setting, Google Maps doesn't work. And in Turkey, like if you put hospital in Google Maps, it will also include the solarium centers, because it's just not that detailed. And there was a need to quickly, update and deploy where the health centers are, which ones were still operational, where was a field hospital, and everything. So it wasn't really something that we thought of before. But at that time, because we were on the ground working with the people, like, hey, we need to know this. There's no other way, because the ambulances don't know where they're going to go. So it was quickly deploying a very quick and dirty thing that changed multiple times since then, over the 1.5 years. So I would really highlight that it's not the product that defined the work, but the problem that you're trying to solve. And that's how we kind of try to stay up to date on what we use. Or I'm sure everyone is like, oh, ChatGPT has a new version. Oh, Claude is better on this and that. And those are great. But again, it's about solving the problem that we work on.
Right. No, thank you very much. I really like that, focusing on the problem and, not, having a solution to find a problem. So, really great point.
Right.
Yes, please go ahead.
Yeah, for our sector, the biggest issue is that sex work is not a protected class. And while sex workers tend to be early adopters of all technology because of federal banking regulations, because of, we often get pushed off of the platforms that we build and innovate because right? So I think that, and then all of the things that happen, this digital suppression, platforms and other banks, like all of these issues could be resolved if sex work is a protected class.
Yeah, no, really excellent point. And that's really also, I think, where we start linking to, basically legal protections, right? So, yeah. So, so as we can see, we have about 10 minutes left this panel. So I'll just ask you, each of you, to quickly tell me in 1 minute what you would like to see. 1 minute, not 1.1, 1 minute. Please, I'll start with you, Lily.
So I think the most critical thing is that when we're looking at gender inequalities being exacerbated, we need to take intersectional perspectives on addressing the digital gender divide. We need to have conversations like this, not just as side events at big global events, but it needs to be integrated into the very way that the technology and innovation is being created. We need to have the stakeholders in the room that can make those changes. And we need to work together across our sector. And it's also critical to ensure greater advocacy regarding laws and policies, as Cinnamon was saying, to protect online rights, digital rights, rights of women and girls, and all marginalized groups.
Great, thank you very much. Prashant, over to you.
So technology and digitization of information in general has been a blessing for everyone. However, digital accessibility is emerging as a big concern, particularly for persons with disabilities. When digital products and services are not designed in conformation with the standards and the best practices, persons with disabilities, despite having digital literacy and skills, are not able to use them. So this is tending to widen the digital divide. So I would like to urge everybody to actually make sure that accessibility considerations are taken into account whenever there is some new development, and existing products and services are also audited and made conformant to the standards. Yeah, thank you.
Thank you. Candela.
I think that forming alliances is essential. As I mentioned, at Bellamente, we partnered with Meta and the Ministry of Health, bringing together our efforts from the private sector, the public sector, and the civil society to maximize our impact. So as a call to action to everyone that is here, I encourage each of you to seek a way to collaborate with other sectors. So through the next initiative that you are designing, we are all side by side targeting the same issues. So let's be supportive.
Thank you. Ara.
Yeah, from the perspective of forced displacement, I would say the world is becoming displaced as and more than we imagined it would, more than the predictions that UN did 10 years ago. And the health systems, especially for women and children, are not designed for them. And the technology can bridge this gap. So my call to action would be invest and innovate in the populations that move, that have to move, and will move. Thank you.
Thank you. Cinnamon.
Yeah, I would really like to see the federal regulations that prohibit venture capitalist funding for sex-related businesses to be removed so that sex workers themselves can receive the necessary funding to create and grow their own technology and their businesses.
Great. Thank you. So, excellent panel. I should have asked ChatGPT to help me with the summary of it, but I didn't. So I'm not going to try to summarize what was said here. But really, I think again, these are conversations that need to, we need to take with us beyond this room. As I said in my opening, we have the Global Digital Compact that really is the game in town currently, right? So next year we have Beijing +30. All of these issues are going to be front and center. So, and it's really important that we start, bringing these conversations to different places, knock on doors, particularly when it comes to the GDC, to make sure that it includes a strong gender perspective. And really, again, and as you've said, really, I think it's not a conversation between two stakeholders. It's not governments. It's not private sector or civil society. These are conversations between stakeholders. It's really important that we place emphasis on that. So thank you very much. Please give our panelists a hand. They've been brilliant. Thank you very much.